All right, so today we're going to be talking about intermittent catheterization, otherwise known as IC. And for this video, we're going to be talking about IC for individuals with a vagina. So to start, before you begin any procedure, you should always perform proper hand washing. In this case, I'm using an alcohol-based hand wash. And I don a pair of clean gloves. For IC, this is a procedure that is clean. It is not sterile. So clean means that we do everything that we can to prevent exposure of bacteria, but we do not have to keep a sterile field. But all of our materials are new and clean. And it's important that when educating a client that you also explain how they keep a clean technique when they're performing self-catheterization, because eventually the goal with nursing could be that you want to teach this client how that they can do IC on their own so that when they go home they can perform this task themselves. So to start, before you begin any procedure, you'd want to do positive patient identification. So I introduce myself to my client here, Jane Teddy, and I'd ask for her full name and her date of birth, and I'd make sure that I'm talking with the right patient. Next, I'd explain the procedure. In Mrs. Teddy's case, she requires IC because she's got a neurogenic bladder, so she's retaining urine after she had spinal cord surgery. So I'd explain this to my patient, and then I'd also explain the materials that we need to perform this task. So first, you'd need a catheter, and there's lots of different catheters depending on the company that you go with. Some catheters will come pre-lubricated, others will not come pre-lubricated. It's important to note that catheters are measured using French. So for example, this one on the package, it says it's a size 14 French. So before performing this procedure or sending a client home to perform IC on themselves, you want to ensure that they have the right size catheter for themselves. Next, if the catheter does not come pre-lubricated, for example, this kind of catheter does come pre-lubricated, whereas this type of catheter does not, you'd want to ensure that you have some sterile gauze and some lubricant jelly that you can squish onto the sterile gauze. It's important that your fingers never touch the part of the catheter that's going into the urethra because we want to minimize the risk of urinary tract infections. If you are teaching a patient how to do IC on themselves, it can help to have a mirror so that they're able to visualize the opening of the urethra called the meatus. So this can be a helpful tool. In terms of cleaning the area, the meatus, before inserting the catheter, you can use wet wipes. Sometimes at our hospital we use these wet wipes similar to the ones that you might get with food, but they're clean. Or if you do have them, baby wipes work great, and you'd require 4 of them. Additionally, it can help to have some clean blue pads. One blue pad is helpful to go underneath your client just in case there's some leakage. And then sometimes, depending on how much space you have, it's helpful to have another clean blue pad just to give yourself another clean space to lay out your materials that you require. In this case, I'm going to use this catheter, which comes pre-lubricated, so I do not need to have any lubrication. So I'll put that onto my clean area, and I'll pull out 4 clean wipes. So I do have a diagram here that I can show you. That it's also helpful to have a diagram that you can show patients as well. But here we can see the labia, which you will spread with one hand. And then you will also see 2 holes. There's going to be the meatus, which is the opening into the urethra, and you also have the vagina. So when you're cleaning this area, it's important that you start top to bottom in one wipe down. It's important that you never go back up and you don't reuse the same wipe because we're trying to prevent a UTI. So we will do that 4 times. And then once that is done, you can open up your catheter. And you'll explain to the patient that you're going to insert this into their urethra. It's important that you do not touch this part of the catheter because this is the part that's going into the urethra and we want to minimize risk of infections. So similarly, we're going to spread the labia with our one hand, and when we enter, it can be helpful to kind of hold the catheter at an angled up position so that the catheter does not slide into the vagina by accident. So when you insert the catheter, if no urine starts flowing out, then that's probably a good sign that you might have gone into the vagina by accident. If that happens, no worries, don't pull the catheter out, leave it in, grab a fresh catheter and open it, and then try again to insert into the urethra. It helps to leave the old one in as like a landmarking spot so you know that that's the wrong opening that you should be going into. So in this case, on Mrs. Teddy. All right, Mrs. Teddy, we're going to perform catheterization now. Do I have your permission? Always obtain consent. I'm going to spread her labia, and I am going to look for the opening of the meatus, and I'm going to insert. I know that I'm in correctly because there would be a squirt of urine as well, and I'd have a collection jug ready to go so that, like a urinal, so I'd have something to catch the urine with. Once you've finished catheterization, you'll notice that urine will stop flowing out of the tip. Once that happens, gently pull on the catheter a little bit more just to get the bottom part of the bladder, and then you can close the top with your finger, or you can kink the catheter as well and pull out the catheter and discard it. It helps to have some extra wipes on hand just to clean the area one more time. And once you have your urinal with urine, it's important to teach clients to monitor how much urine came out, because knowing how much urine came out will tell you when you should be performing your next IC. I believe I do have a resource here. At our hospital, we provide our clients with this chart, which, if they're on IC protocol, says that if they have a urine volume of 400 mils or less, then their next IC will be at 6 hours time. If they have 401 to 600 mils, their next IC should be in 4 hours time, and then 600 mils or more, their next IC should be in 3 hours time. Obviously, some patients, they might not be exactly on the schedule and they might feel that they have to go before that, but if they don't have any sensation, then this is a good protocol to follow. So once you have your jug, you're gonna look for that volume so you know when your next time that you should do your IC is at. You're also gonna look at the color. So is it a pale yellow or is it a deep, dark yellow? If it's super dark, then that's a pretty good indication that you might want to be drinking a little bit more. If it's a nice pale yellow, that's a good indication that you've been properly hydrated. You should also note if the urine is a bit cloudy or if it smells a little bad, because these are often indicators for a urinary tract infection. And for some people, like Mrs. Teddy, who has a spinal cord injury, she might not show the typical signs of a urinary tract infection, such as having a fever. So it's important to instruct your clients on how they can identify these urinary tract infections, because it's a very common complication when clients are having to perform intermittent catheterization. Okay, so today we're going to be talking about intermittent catheterization, otherwise known as IC, for individuals with a penis. So before performing any procedure, it's important that you perform hand hygiene. I've got an alcohol-based hand wash here, so I'm going to wash my hands. And then I'm going to don clean gloves. It's important to note that for intermittent catheterization, that this is a clean procedure, which means that we're trying as much as possible to reduce the exposure of bacteria. However, we are not keeping a sterile field. So it's important to instruct your clients on how to keep a clean technique when performing IC, so that when they are discharged, if they're still performing IC on themselves, and they know how to keep the area clean, perform the procedure cleanly, and reduce the risk of a urinary tract infection. So next, it's important that you make sure that you have your right client. So I'm going to perform proper patient identification. In this case, I've got John Teddy, so I'd ask for his full name and his date of birth to make sure this matches and that we're performing the right procedure for the right patient. Before we begin, I'm going to kind of talk about the equipment that we'll need to perform IC. So in this case, we have got the catheter. So similar to females, the catheter is measured in French. It's important that you make sure that you have the right ordered size. So in this case, this is a 14 French, and it's also important to show clients where they can find that size on the catheter if they're performing this themselves, so that they make sure that they also have the right size. As you can see, if you watched our other video where we talked about catheterization for individuals with a vagina, the catheters are quite different in size, and this is because for individuals with a penis, the urethra is a lot longer, so we need a longer catheter. So in this case, this catheter does not come pre-lubricated. So before we begin our catheterization, we're going to have to lubricate the catheter. So it can help to have 2 clean blue pads. So the first one, it can help to have it go under the patient's bottom, just in case there's some leakage. And then it can also be helpful to have a second one to put your equipment on so that you're maintaining a clean environment. So to lubricate the catheter, you'll want to get some sterile gauze. You're going to open the sterile gauze. You're not going to touch the gauze. And then some lubricant. It doesn't always come in individual packets. You might have, if you're at home, you might have a bottle of it, but at the hospital we have these individual packets. So you're going to squeeze the lubricant onto the middle of the pad. Make sure that you don't touch the end of the lubricant packet just to prevent contamination. It's also possible that when we're cleaning the area that you might use individually packaged wipes, or you can also use something like baby wipes as well if you find that these are more comfortable for you. Either option that you use, you'll need 4 of them. So I'm going to take out my wipes. 1, 2, 3, 4. So when you're cleaning the patient's penis, it's important that you hold the penis by the shaft, and you might have to retract a little bit of the foreskin to show the opening to the urethra. You'll take your wipe and you'll start at the tip and go in one direction all the way down. It's important that you use a new wipe and in a new direction, just so that we avoid contamination. So again, start at the tip of the penis because that's where the catheter is going in, And then we're gonna go all the way down, and we're gonna perform that 2 more times. Tip, all the way down, and again, tip, all the way down. We'll just leave that like that. Grab your catheter. You'll open your catheter. It's important that you only touch the catheter by this top portion and you don't touch the portion that's going into the client's urethra. It's hard to see, but on this specific catheter, there's a blue line. And then at the bottom, for male catheterization, sometimes it can help if the end is something that we call a coude tip, which means it's pointing up slightly. And this just helps to guide the catheter into the urethra and into the bladder. So when you're inserting this catheter, it's important that you are inserting it coude up. So it's important that the tip that's pointing up is pointing up, and it's not, you don't want it to be pointing down because that will be very uncomfortable for your client. So I'm gonna open up the catheter. I'm going to grab my gauze with the lubricant, and I'm going to start at the top. I'm going to kind of go in a twisting motion to lubricate the catheter. And I'm going to go all the way to the bottom. Sometimes you kind of have to open up your gauze again because you'll be using this gauze to hold this part of the catheter so it maintains clean. Next, I'm going to ensure that my catheter is coude up and facing towards the client's penis. And then I'm going to hold the catheter like this. I'm going to take the client's penis and, well, before this, obviously, I obtained consent for this procedure. And I'm going to hold the penis at a 90-degree angle to the client's stomach. And I'm going to insert the catheter into the urethra. You don't want to go too fast, so it's important you go slow, as this can sometimes be a little bit uncomfortable for clients. So eventually, it's hard on this specific diagram, but eventually the catheter would look like something like this, where the catheter is coming out, and you'll know that you've reached the bladder once there's a gush of urine. If you're having trouble getting into the bladder, like if you're feeling a bit of resistance, sometimes it can help if you can ask the client to cough, because that can sometimes help relax the sphincter. So once the urine has stopped flowing, similarly to our last video, you want to pull out the catheter, not touching the catheter part a little bit to drain the very bottom of the bladder. And then once urine stops flowing again, you can either cover the tip with your finger, or you can kink the catheter and pull out the catheter. And then you can offer your client another wipe to clean up. Again, you want to note how much volume there was in the urinal, because this will indicate when you should be performing your next catheterization. If your client is on a protocol, the typical protocol we recommend at our hospital is that 400 mils or less, your next IC is in 6 hours. 401 to 600 mils, your next IC is in 4 hours. 600 or more, your next is in 3 hours. When clients are performing these catheterizations on themselves, sometimes we recommend that it can be helpful to, after you perform your catheterization, to figure out when your next IC is scheduled for, and then you can put an alarm on your phone so that you forget. And this is especially important if you have no sensation that your bladder is full, because we want to prevent something called autonomic dysreflexia, which can occur in some individuals with spinal cord injuries who have an injury at the T6 level or above, and it can cause a really high spike in blood pressure. Again, if you do feel the sensation that you do need to urinate before your scheduled time, you still can, but this is just our typical protocol that we recommend as well. So again, you have your urinal. You'll want to note the color. Is it light or is it very dark? If it's dark, this can indicate that you want to drink a little bit more. and if it's cloudy or if it's smelly, then this might be an indication of a urinary tract infection, and you'd want to let your healthcare team know. We can perform something called a dipstick test, where we can look for any presence of white blood cells or proteins or blood, which might indicate a urinary tract infection, and we can take a sample of your urine. But it's important for clients with spinal cord injuries to know for these alternative signs of urinary tract infections, because they may not spike the usual fever that can come with a urinary tract infection. So we often have to have other indications that a client may have a urinary tract infection. So. Okay, so today we're going to talk about a procedure called digital stimulation. So the word digital comes from the word finger, and then stimulation is just from the movement of the finger in the rectum. And this is a procedure that individuals living with a spinal cord injury often have to learn to do in order to stimulate a bowel movement. Sometimes, depending on the location of your injury, you may experience something called a neurogenic bowel, which means that the feces have trouble passing through your colon, and digital stimulation can stimulate for that feces to move in your colon. So to perform this procedure, it's important that you wash your hands first. And I've got an alcohol-based hand sanitizer. Wash my hands. I'm going to don clean gloves. If a client is learning how to do this on themselves, they are also welcome to use gloves. Some people prefer not to, but that's up to the client. As long as their hands are clean, that's what matters. But if you're performing this on somebody else, then you definitely need gloves. I'm going to put on gloves. Next thing is I'm going to make sure that I have my right client. So this is John Teddy, and so I'd ask for his first name and last name, as well as his date of birth. Then I'd explain the procedure, and I'd explain that for this procedure, because of his neurogenic bowel, the physician has suggested that we perform something called digital stimulation, where we will take one finger and we'll apply a little bit of lubricant, and we'll insert it into the rectum, just about a half finger's length, and we'll move our finger in a circular fashion around the walls of the rectum gently for about 30 seconds. And then we'd discard this glove, and we tell the client that it's important that we wait 5 or 10 minutes for the bowel movement to leave. Next, I'd come back in 5 or 10 minutes and check on my client. For some clients, they need to have digital stimulation a couple times. So if you insert your finger and you still feel bowel movement, sometimes it helps to again do another round of digital stimulation. So you will perform digital stimulation until there is no more bowel movement after each 5 to 10 minute interval. For lubricant, if you're at home, you might just have a bottle of it provided by home care. In the hospital, we just have a package which you can apply onto your finger. Some clients will also be prescribed lidocaine jelly if this procedure is painful for them. You might have hemorrhoids, which can make digital stimulation a little bit painful. So if you have an order for that, or if the procedure is very painful for you, you can talk to your healthcare team and they can put an order in for that, where your nurse can mix some lidocaine jelly and some lubricating jelly together while they're doing digital stimulation to reduce the pain.